Thanks for tuning in to Spend Less, Live Well with Dr. Josh Luke, dropping serious wisdom, integrating healthy living, finance, and faith into the healthcare process to live your best life. Watch us on YouTube or listen anywhere podcasts are found. Spend less and live well.
Folks, welcome to Spend Less, Live Well. If you have read either of my Health Wealth books, Health Wealth is Healthcare Bankrupting Your Business, or Health Wealth for You, 11 Steps to Save Big and Live Healthy, then you're familiar with an alternative to health insurance called cost sharing. And you know that I'm a member of cost sharing, have been for several years. I'm a huge advocate of it. And you probably are aware, if you've read or studied any of those, that an organization like MediShare, MEDI-Share, was a faith-based cost-sharing organization that was grandfathered by Obamacare as an alternative to insurance. And there are several others that have really emerged as popular choices. And the pandemic has really brought those options to the surface because 27 million Americans are unemployed and faced with either COBRA at $1,400 or $1,500 a month for their family oftentimes, or going without health benefits. And so today, I want to introduce you to our guest, Chris Faddis, the founder and president of a cost-sharing organization called Solidarity. Welcome to the show, Chris.
Hey, thanks for having me, Josh.
Can you just really quickly, for those who aren't familiar with cost-sharing, just give us like a 90-second, your description as a founder of a great cost-sharing organization, what it means to you and what it is?
Yeah, members of like Solidarity Health Share and other cost-sharing groups, we agree to share each other's medical expenses. So rather than going and paying an insurance company an inflated premium for limited benefits and all kinds of restrictions, what our members do is they agree to become self-pay patients, in a sense, and then share each other's expenses. So every month I set aside my monthly share amount that I pay into Solidarity Health Share, and then Solidarity Health Share facilitates the sharing of medical bills with mine and the other members' dollars. And so, many months I don't need the dollars, and then there's months when we do. And, we've had a couple childbirths in the ministry, and, the ministry shared it. And then we've also had many instances where our dollars were shared for other members. But the beauty is, Solidarity gets to act as the facilitator of that sharing. So we do all the collection of the funds. We allocate the funds for these medical expenses. We actually help process the bills and work with the members and their physicians and hospitals, on the billing and everything, and then, send the payments out to the provider. So we do a lot of the work for the member, but ultimately our members are cash pay patients, and they're all agreeing to join each other. So it's you and me and a bunch of friends, Josh, that are coming together and sharing each other's dollars. And it really kind of gets back to that sense of what healthcare should be. Healthcare, the insurance really was meant to be, kind of something for the excess, but the day-to-day stuff, buying aspirin, all those things, that's all on us. And, we're there for each other when we need it. And so we're bringing it back to that point. And what I love about it is it prioritizes the doctor-patient relationship in a profound way, and really helps to kind of centralize that's really the most important piece of healthcare, is having a relationship with a physician you trust. And, one of the most important pieces, at least, and being able to centralize that relationship.
So cool. Yeah, I've been so pleased with my family as well as I have been with our cost sharing plan. You mentioned I'm a member of a non-faith-based cost sharing plan. You mentioned, you referred to your community as a ministry. So can you tell us, A, how is it a ministry, and B, if there's someone who isn't really an active churchgoer or a member of the specific church you guys are affiliated with, are they still eligible to join?
Yeah, we found it as really it's actually a partnership of Mennonites and Catholics together who helped launch Solidarity Health Share. So we're one of the existing ministries that actually is exempted. Our members are exempted by the Affordable Care Act. And so, our members, while we have kind of a Catholic founding and we adhere to the ethical principles of the Catholic faith, we actually are open to people of like mind. And so our statement of faith is one that people need to be able to agree to, and they're certainly going to believe in God, and they're going to align with our ethical principles. And so as long as people are in favor of that, which we've had many members who maybe they're Catholic or Christian, and then they bring along their brother or sister and friend and everybody else, and maybe some of those people weren't fully in line or didn't fully wouldn't have said they were, but as they read through our guidelines and our statement of faith, they tend to agree. So we have a great mix of folks. I would say it's a majority of Catholics and Christians, but people are welcome to join as long as they're willing to adhere to those guidelines and sign on to that.
So share with me what led you to healthcare and what led you to cost sharing. Just there's always a great story to go with a solution that really addresses this American crisis of healthcare affordability.
Yeah, for me, it's a sad story that I think is turning something painful into something beautiful, right? So my first wife was diagnosed with stage 4 colon cancer in 2011. And it was very advanced and very little chance at cure. And we went down the path of traditional treatments, traditional insurance, everything, and really started to find that, right away, there was really not a lot of success. It was actually going backwards. And ultimately, we found some advanced and alternative therapies that we felt would have more promise and be more of a chance to kind of give her a leg up on this disease. And ultimately, that wasn't going to be covered by insurance. So we actually went out, and I just went out in faith, and I posted a fundraising page and said, please help me save my wife's life. And, over the course of 30 days, I believe it was around $35,000 was raised online. We kicked off her treatments. She did a radiation oncology, a very advanced targeted radiation oncology protocol, as well as some advanced and alternative therapies. And, pretty big regimen. We were living in North Carolina. We moved back to Arizona. Friends came together. Some other friends in my family threw a fundraiser at a church and raised another $15,000. And lo and behold, we saw the community come together and really fund her healthcare, right? And she bounced back. I mean, she went from being knocked out for 2 weeks after every chemo treatment to having energy every day after her treatments, being able to engage with her family, being able to eat and thrive. And the cancer kind of knocked back, the tumors shrunk and those things. And what we saw there was what we thought healthcare should be. It's coming together in those times of crisis and helping each other, working with providers that we believe, we meet with and we believe they have what it takes to help us. And we want to take their course of treatment. And we were able to drive those decisions, And so she did end up dying in 2012. She lived a total of 17 months, but her prognosis was 2 months. And I believe that those extra 15 months were every bit worth the extra effort we took. And what I saw in that was I thought, man, this is what healthcare should be. And I kept, as we were going through her cancer journey, I would constantly have in the back of my mind, how can we do this for other people? And, fast forward a year later, right before she died, the Affordable Care Act mandates came out. And a lot of people, especially people of faith, were upset about some of the mandates and some of the things in there. And we just kept talking about it, a group of friends and one of my good friends who's a physician. And, just one day, and for those of faith, it was Pentecost Sunday, which is a big day for us in the church. And it was just this inspiration to say, we got to do something. And the only thing we thought was possible was healthcare sharing. And so we started researching, we started looking at it. And within a week, I believe, we had our initial business, model and plan and started, going out to say, hey, we're going to do this. Now, it took us a few years to launch because we wanted to make sure that we were able to have, the legal recognition we needed for our members to have the exemption. There's a lot of work that went behind that. But in the beginning, it was really about just providing this option. And then as we got into the system, I started to see how broken it really was. And everything that, I know all about, Josh, and this world of overbilling and overpricing and, the hospital control of physicians and all these pieces became even more of a reason to do this. So we've been in out in the public as Solidarity Health Share. We launched publicly in 2016. So we're almost at 4 years, and it's a fight that I don't know that we'll ever be out of, because I think this is something America needs.
Yeah, so I have a question for you. I'm a cost sharing member, and so I'm a cash patient, as you said, and sometimes that scares people when they're used to health insurance. And folks, let's just get past the myth that we were brainwashed during the 80s and 90s to believe that our employer will pay for our health care, because whether you like it or not, you're paying $23,000 a year for your family for the right to have health insurance. Before you see one doctor, before you get one prescription, the average family is paying $1,500 a month on a $5,000 deductible plan. That's $23,000, guys. That's the numbers, and that's you when you stop and add it up. So people are starting to say, what are the alternatives? We should have started asking this years ago, but we're all brainwashed to think healthcare should be paid for, and we wake up one day and we're paying for it. And so, guys, the pandemic with all the folks that are unemployed is really leading people to become what I call EHCs, engaged healthcare consumers. And in the 10 free tips to spend less on healthcare, in the Health Wealth books, cost sharing is literally the anchor of all of those tips that can save you $12,000 a year right off the bat if the majority of your family is healthy. That's a big if. But even if it's not, it forces you to become an EHC, an engaged healthcare consumer. In my plan, Chris, the first $1,000 of an episode, okay, I just had this ugly elbow here drained. I had a bursitis, okay? I was just feeling it as you were talking, going, uh-oh, it's coming back. I go to my direct primary care doctor. I pay him $150 a month. I don't pay a dime if he keeps draining this thing. It's all included.
Right.
My point is, if I had to go to the hospital for that, my threshold is $1,000 that then I can start submitting bills and asking for the community to help me pay. Do you offer different packages, or is yours 500, 1,000? Can you speak to that a little bit, please?
Yeah, you know, we started out with we originally were looking at that per incident kind of what we call an annual unshared amount, you know, and we actually, what we saw was a lot of the groups would do that, you know, $500 or whatever it was per incident, and then, you know, and then it would cap out. So we actually cap it. So what we do is an annual unshared amount for your family. So it's $2,500, you know, for the family, you know, program. I pay $549 a month. Then I have a $2,500 out of pocket. We do actually, wellness visits are shared before the annual unshared amount, as well as we're actually releasing guidelines to allow for sharing in direct primary care. So if a member has a direct primary care doctor, we'll share up to half of that cost, roughly, and that goes towards the annual unshared amount as well. And the idea is, like you said, to be engaged, to know what's going on in your healthcare, but also to make sure we're there. I mean, you know, as you said, a lot of these big our employer plans are $5,000 and $10,000 deductibles, and it's, you know, before you even see someone. I have an insurance agent for the company that does all of our company insurance, you know, for liability and stuff. And he told me recently, he said he has a $13,000 deductible, and he had a procedure that cost $14,000. So he was going to have to pay $13,000 out of pocket before the insurance would cover $1,000. Instead, he went to the doctor and said, "What would the cash pay price be for this?" And he paid $3,700. You know, it's just unheard of. Why are we paying this much money? I didn't even ask him what his premium was.
So that's crazy. So, folks, my guest is Chris Faddis, the founder and CEO of Solidarity Health Share. You can find him on LinkedIn at Chris Faddis. You can find Solidarity on Twitter at SolidarityHS. And can you share your website with the folks as well?
Yes, it's solidarityhealthshare.org, solidarityhealthshare.org. You can find us there. We're also, you know, obviously we're all over all the social media channels and everything. And there's lots of information there. There's lots of, you know, you can get quotes, you can do all of that. And we also encourage people, Josh, just to give us a call, because we certainly can answer a lot of questions quickly over the phone. So 844-313-4999.
So you can call that number, folks, or you can go to solidarityhealthshare.org and get the number there, or get the information you want. Chris, we got about 30 seconds left as we wrap up part one of this show. Can you just in that 30 seconds talk about, is the majority of your consumer or your customer base direct to consumer, meaning can anybody listening just go there and sign up, or do they need to be affiliated with a small business?
No, they can go direct to us. That is primarily where our membership comes from. Everyone can come directly as a family or as an individual. We have plans, we have 3 different program levels, and then obviously, individual and couple and family plans. So it's a great organization. Our members are very committed, and we're very impressed by how much they take this seriously, how much they're spending on their healthcare and try to maintain that, to manage that dollar.
Folks, my guest has been Chris Faddis, the founder and CEO of Solidarity HealthShare. You can find them online at solidarityhealthshare.org. This is part one of 2 sessions we're going to do with Chris. So if this piqued your interest, we're going to dig a little deeper into cost sharing and the uniqueness of Solidarity in part 2. Thanks for joining Spend Less, Live Well. And Chris, thanks for joining us.
Thank you, Josh. God bless.
Thanks for tuning in to Spend Less, Live Well with Dr. Josh Luke, the crossroads of integrating healthy living, finance, and faith into the healthcare process to live your best life. Watch us on YouTube or listen anywhere podcasts are found. Spend less and live well.